Hello, everybody. I want to welcome you to LTSC's Homesick webinar series, where we hope to be exploring how to combat the homelessness crisis with community-based remedies. I'm Erich Nakano, Executive Director of Little Tokyo Service Center, and so happy you are able to join us today. As I think we all know, the homelessness crisis in LA County is massive, and it is everywhere. There is no neighborhood or community that isn't touched by it. It is a humanitarian crisis on a horrific scale for those who are on the streets. And it is a crisis of humanity for all of us, feeling their pain and wondering what we can do. And so we wanted to initiate learning and discussion on this complicated issue with all of you. Now, we don't claim to have all the answers. I think no one does. But at the same time, we believe that through understanding the roots of the crisis, how it happened, how it came about, and learning about how different groups and organizations have been trying to address it, that solutions can be found. For our part, we are stepping up our services and work on the issue, which we'll talk about later. We need to do our part to be part of the solution. And we want to bring all of you along with us. So this is episode 1 of a 3-part series. Today, we're going to be talking about the roots of the homelessness crisis and its impact on lives and the surrounding community. And we're very fortunate to have some very knowledgeable and insightful speakers with us today. Bibiana Rosalia, a philanthropy associate with PATH, People Assisting the Homeless. We have Deon Turner, public policy advocate with the Inner City Law Center, and Grant Sunoo, Director of Community Building and Engagement for the Little Tokyo Service Center. Before we begin, a couple housekeeping items. First, please note that we're using auto-generated closed captions, and so we apologize in advance for any typos or misinterpretations that may happen. We'll have time after the presentations for a question and answer session. Please submit your questions using the Q&A function in the Zoom webinar. So that's a icon on the bottom right-hand side of your screen. Okay, so let's get started. It's my pleasure to introduce Bibiana Rosalia. She is a resident at Casa Hewa, which is one of LTSC's affordable housing buildings. And she's also a new member of the Little Tokyo Service Center's board of directors. She works as a philanthropy associate for PATH, the organization called People Assisting the Homeless, and is a sound healing practitioner. As someone with lived experience with homelessness, she is uniquely positioned and passionately dedicated to helping our unhoused neighbors. Bibiana joins us today to share her story and experiences with homelessness, both as a formerly unhoused person and as a current housing advocate. Bibi?
Thank you so much, Eric. Thank you all for attending today's webinar. I'm gonna share my screen right now. So if you can just give me a moment. Okay, so again, thank you for attending. As Eric mentioned, I am a resident here of Little Tokyo. I'm actually a resident of one of their affordable housing developments, Casa Hewa, and have been for almost 4 years. So I'm happy to be sharing my journey through the lived experience of homelessness. So several years ago, in 2008 and 2009, I worked as a merchandise coordinator in the fashion industry. And I worked for a relatively small retail boutique company here in downtown Los Angeles, right there next door to the Pantry. And I worked for the company for 8 years. And during my time, while working there in 08, 09, we had the housing crisis. And as some people remember, the economic meltdown. And one of the major industries that was impacted, of course, was the retail industry. Most people weren't able to afford to buy, clothes or have extra money. So many people weren't spending. And so our company wasn't immune to the crisis. We shut down, as many other companies did during that time, and filed for bankruptcy. And I was actually one of the last skeleton, I was the skeleton crew of the company. And I remember it being a very, very scary time for all of us and having to reassess what I was going to do. And so, of course, I did what everybody else did. I applied for unemployment and I looked for work. And I remember at the time I didn't have a bachelor's, I had a high school diploma, and it was an employer's market. So it was very, very competitive to find just basic administrative work. And I wasn't making any leeway. So I was working a lot of odd end jobs. I am also and was at the time raising my son. And he was a preteen at the time. And I was struggling to make the rent and working all of these odd end jobs, from janitorial work to working special events venues, to being a card stalker for American Greetings and collecting unemployment so I could supplement my income. Now, during that time, I lived in this what is similar to what you see pictured here, which was a converted unit. So it was a garage converted into a studio. And so, this type of structure isn't uncommon. It's pretty commonplace in LA, but at the time, many, many years ago, it wasn't, I guess you could say, considered legitimate. And so I had lived there actually for 11 years in mid-city Los Angeles, right off of La Brea and Olympic. It was a great neighborhood. It was surrounded by a lot of single family homes. And in 2011, my landlord was cited for not having a legal zoning permit to rent the unit, which I wasn't aware of. But nevertheless, they sent him a letter and told my landlord that he had 3 weeks to vacate the unit, or he was going to be penalized. And so I only had 3 weeks. And so, of course, I scrambled and I was scared. And I remember reaching out. First of all, I called 211 for resources. And of course, 211 is a resource to find out what's out there. However, when I called, what my options were basically living in a shelter. And so I knew at that point in time how the shelters operated, simply because I did a lot of volunteer work with my church at Union Rescue Mission. And so I knew that was going to be a last resort. So I reached out to my network of people, primarily my social support network, which was my church, and did a blast email and reached out to my pastor for some type of assistance. And really the people that really came through were many people, but in terms of helping me with my housing were the single mothers in that church. And I had a good friend who's a single mother, and she decided to help me and take me in with her son in a 2-bedroom apartment. And I moved in with her and her son in the Valley for several months. And during my time there, in March of 2012, my dad died unexpectedly. And so that kind of pushed everything back for me as I was trying to rebuild, because there weren't any resources and finances to bury my dad. So I had to figure out with my brother how to bury him for a month. And so I was gone for a month, and then I came back and was just getting back into the rhythm of life. And then my friend just, we sat down and she said it was just too much for all of us living together. And so I understood, and I didn't take it personal. So I knew that I was back to square one and I had to find another place to live. And so again, I reached out to my network of people, and being who I am, I'm always trying to think 3 steps ahead. So I tried to make sure that I had a place to sleep at night with my son, and we weren't sleeping in our car. So I actually just showed up at the mission one day during the summer, Union Rescue Mission, because I wanted to secure a bed. So I sat there I remember for a couple of hours in the waiting room, waiting to see a case manager with my son. And I remember the fear and desperation in my son's eyes. So as a parent, I felt that was a rock bottom moment for me. It was a low point because at that point in time, I felt that somehow I failed as a parent. But I then I sat down, saw the case manager, and she explained to me that it wasn't like where you could secure a bed in advance. It was where if you were in a position where you had no place to sleep, then you come and you do intake. So that was explained to me. So then I left, and thankfully another friend reached out to me and told me to try to apply for the Dream Center. And the Dream Center is a faith-based nonprofit in Echo Park. This is their building. It's located right off the 101 freeway, and it inhabits the Old Queen of Angels Hospital. And I called them and eventually was able to get an appointment to interview to try to be a part of the program. I interviewed with one of their volunteer case managers and was able to get in. And it's not easy to get into the Dream Center. There's an extensive waiting list. They're set up in terms of shelter is private rooms. So it's not the typical communal kind of like everyone living in or staying and sleeping in one room with bunk beds. It is private rooms, especially for those that are on the family floor. And so I did get in and did intake and lived there from 2012, actually all the way up until 2018. However, I was a program recipient from 2012 to 2015. I was going to college at the time and then transferred from LA City College to Azusa Pacific University. I worked part-time at a brokerage firm while raising my son. And then I decided that I am doing all of the prerequisites to be a part of the program at the Dream Center. I did a lot of outreach work. It inspired me and motivated me to want to help people. So I wanted to get into the nonprofit sector. And I wanted to transition from private to nonprofit. It was tough. I didn't have any experience. So, and wasn't making any leeway. So the Dream Center had a position open in their development department. And I interviewed and got the job. And so I kind of worked different hats at the DC, from corporate relations to development to media and marketing shortly before I left. So during my time there, I did try to find affordable housing. And so there wasn't any housing navigators at the DC. So you were sort of left to your own devices to research and find your own housing. So I researched on my own all the different affordable housing developments in the city of Los Angeles. And I applied to a lot of them. And I remembered applying to Casa Hewa back in 2015. And there was a waiting list, as many of them have, right? And there's a scarcity of affordable housing in the city. And so I waited 3 years. And in 2018, I got the call in January saying, hey, you probably don't remember applying here, but you're at the top of the list. And I was like, oh, I actually don't, but this is great. I was super excited and went through the process of, filling out the paperwork and applying. And I was really, really grateful. And I moved in May of 2018. I remember it was a surreal moment for me, actually having my own place and not sharing a bathroom and being able to cook again. It was a really good feeling to have my own place again. So I then transitioned and worked for PATH around the same time in June of 2018. So I want to just transition and segue over to what we do at PATH briefly. So PATH again stands for People Assisting the Homeless. We are a statewide homeless services agency. We've been around for 34 years. And our mission is to end homelessness for individuals, families, and communities. That's a picture of one of our clients that made it home. And we have different regions throughout California. So we have our flagship in LA, Santa Barbara, San Diego, San Jose, Orange County, and Sacramento. And then this is a snapshot of just our impact that we've made in the last couple of years. Completed 15 communities. We have a couple of communities in construction. 12 communities. Coming soon, we've housed over 12,000 people. We service over 150 cities in California, and we house on average 20 plus individuals per week. And this is a map of all of our different locations throughout California, which includes our permanent supportive housing sites, interim shelters, and cities that or areas that we do supportive services in. And this is our strategies to end homelessness. So anywhere from homeless prevention, diversion, problem solving. We do strategic outreach where we have our street outreach teams that go out and build, cultivate relationships with those living on the street. We also have a rapid rehousing division, interim housing. And then the next slide is also our different housing services that we provide, which is again, interim housing, which is our transitional housing sites, rapid rehousing, and of course, permanent supportive housing, coupled with wraparound services. And that leads into our real estate development branch arm, which is Path Ventures, and they solely focus on building affordable housing, either from the ground up or converting buildings into permanent supportive housing. And then lastly, I just wanted to share a quick slide about the LA HOP portal. So some people know about LA HOP and a lot of people don't, but LA HOP is a referral service. You can self-refer someone that's experiencing homelessness. If you go to lahop.org and just follow the instructions, you can actually help self-refer somebody that's experiencing homelessness, whether it be a friend or someone that you've cultivated a relationship with on the street. And what they do is once you submitted that referral, it then matches a outreach team member and deploys them out to the area that you have indicated in your referral. So this is one of the ways that that you can help somebody that's unhoused. And that's all that I have. I just wanted to thank everybody for allowing me to share my experience, and thank you for attending, and thank you.
Wow, Bibi, thank you so much for sharing your journey and your honesty. I think it's something that I'm sure everybody got a lot out of, and understanding the so many varied journeys that have led people to an unhoused situation, as well as the varied journeys to reclaim lives and put yourself and your family on the right track. So it's quite inspiring. Thank you so much for sharing. Okay, so let me introduce next Deon Turner from the Inner City Law Center. So Deon Turner has been with Inner City Law since April of 2020. He's worked on many nuanced issues in the homelessness and housing spaces. He's worked on many issues within homelessness and housing pipeline, including the anti-criminalization of homelessness. He dedicates his work to provide a people-centered approach with community and lived experience design towards homelessness and housing solutions. And then let me just mention that, we're proud to be partnered and in coalitions with Inner City Law Center around issues of homelessness, affordable housing, and equitable development. Deon, please welcome Deon.
Thanks, Eric. Happy to be here for everybody. Let me share my screen really fast so that way. Get started. All right. Sweet. Hi, everybody. My name is Deon Turner with Inner City Law Center, public policy advocate. And first, before I begin, I just wanted to acknowledge and validate Bibi's story. I think her story is a testament to what really happens, in LA, and what happens to so many folks and individuals. How with just one mishap, one medical bill, one event away, right, from falling into the trap of homelessness. So thank you, Bibi, for sharing your story and for sharing how resilient you are and how enduring the process can be. And so I just wanted to share at a little, at a higher level, 50,000 foot approach of kind of the policies and the root causes for homelessness And, I think there is such a substantial need to understand, what these causes are, because these policies have been systematically intentional and have really only affected our Black and Brown communities, and even amazing folks like Bibi has fallen trapped to some of these policies. So first, I just want to take a look at some of the numbers that we're seeing in LA County. There was a 13% increase from 2019 to 2020. And in the city of LA, there was a 16% increase from 2019 to 2020. And as I go further, our numbers and this data that you're seeing is going to be based in 2020. 2021, there was an account due to COVID and to policies to protect everybody and to keep safe. So all our numbers here are going to be based on 2020. So inflow increased in that year. And I think that just shows the dynamic nature of homelessness. Every day, for example, an average of 207 people exit homelessness and about 227 people become homeless. So I just wanted to pull up the demographics, which sort of each of the demographic category in terms of the LA County's population represented, but in conjunction with its homeless representation in LA County. So, we have Hispanic or Latinos representing about 48% of the LA County's population, but are 36% represented in the homelessness count. But what's most startlingly was Black and African American folks are only about 8% of LA County's population, but really about 34% of the homelessness population folks. And so there's definitely there's racial inequities, there's racism involved in why certain people fall into homelessness categories. Let's take a look at some numbers in CD14, which Little Tokyo Service Center is at. In 2019, they had a total of about 7,638, and in 2020 about 7,617. So as you'll see in these trends, there's a sharp increase from 2016 to 2017, but it does level out and it does stabilize from 2019 to 2020. And this can be, from the kick in of Proposition Triple H and from other funding streams that have and other certain policies that have sort of deterred and mitigated the rise and increase of homelessness. But there's still, of course, so much to be done. And then just wanted to take a look at Little Tokyo specifically. 2019, about 95 individuals that were counted. 2020, you just see a slight decrease of about 84. And with this count coming on in 2022, we'll be able to see, what effect and what impact, some of the funding streams and mechanisms have had. And I just wanted to point out that LA's housed people become LA's unhoused folks. Homelessness is essentially a grown problem, not an import problem. 80% of unsheltered Angelenos have 80% of unsheltered Angelenos have been in LA for about more than 5 years, and 2/3 were permanently housed in LA before they became homeless. So, there's some dispelling, there's some myths that folks are imported here, which is not the case. Most people in LA have fell into the trap and then became homeless. Substance abuse and mental illness. I think there's, just given the stress that one endures to become homeless, such as job losses, healthcare issues, maybe you have harassment with your landlords, and, you're followed with the stress of what that could mean. Where am I going to go? Where am I going to live? What's going to happen to my family? Do I have any other dependents? Am I a burden to others, right? Can I reach out to others? And then followed by the reality of being in homeless, living on the streets, living in the shelters. What does that mean? Being hypervigilant, hyper aware, seeing some victimizations by others, really affected by the criminalization. That brings a ton of mental health challenges and issues. And there's that desire, right, to turn to fill those, those anxieties and stress with substance abuse. But only a small percentage of folks have substance abuse and mental illness. It's not a majority. So as we see in 2019 and 2020, 2019, about 29% of adults had either a substance use disorder or serious mental illness. 2020, that increased to 41%. But the inverse means, right, that about 59-60% of folks are not or did not fall into homelessness because of substance abuse or mental health illness issues. or are enduring. And so the question is, what was the real reason for that person falling into homelessness, right? And as we'll see later on, economic issues, economic costs, right, economic downfalls are the primary reason why people become homeless in the first place. So, resources inevitably make a difference. There was about 2019, 22,700 housing placements, and this was up from 5% of that previous year, which more than double the annual placements since Measure H, and about 88%. So this is how we know resources work. It's about 88% of individuals that were placed in permanent supportive housing systems since 2018 have not returned to homelessness. And so LAHSA had recently also established a housing central command, and that plan was to accelerate these placements even further, despite having such a limited supply. And so Housing Central Command, for those that are unfamiliar, they track LA's permanent supportive housing portfolios across all jurisdictions, and they assess vacant and filled houses, connect providers with case managers and partners to ultimately house people experiencing homelessness. And so we know through the HMIS data that 88% of those that went through the system in 2018 have not returned into homelessness. So the big question is, right, why are so many people homeless? Why are so many people homeless? Two-thirds of unsheltered individuals are homeless for the first time. And according to LAHSA, in their 2020 homeless count, which I'll put in the chat or for you all to access if you're interested in seeing all the data, all the demographics of the count of 2020, 59% of individuals cited economic reasons as the primary reason for falling into homelessness. Individuals stated that they were about, one job away, one medical calamity, one financial inconvenience, a citation, a car ticket, car being towed, from falling into homelessness. And 39% cited having a weakened support network, not having enough family or friends or that support needed to help. It could be couch surfing, it could be, staying with a friend, you helping others, using others so that we can maintain your situation, right? 39% mentioned that they had a weakened or no support network at all. And 24% had a disabling health condition, that led them into homelessness. And so we'll see that now the system intentionally selects people to fall into economic peril. Certain people, low income, people of color, have crises that are affected by certain prejudices in society, and these individuals are more likely to fall into homelessness. So the housing market has never adequately housed low income folks, especially people of color. We see segregation and redlining that's led to imminent and mandated housing discrimination, which also leads to employment discrimination, right? If you're displaced and you're living far away, and there might not be any jobs there, only certain jobs are available, right? Which sort of leads to the amount of income that you can get and the schools that you're able to access. There's of course the inability to access healthcare, which as we know is immensely expensive and even scarcer in low-income communities. Inadequate safety net funding, right? And so, not many people can afford a $500 emergency funding that they need, right, to get out of a situation that they need. And of course, we see the criminalization of poverty. When you're poor, if you have nowhere to hang out, you can get hit with a loitering ticket. We see police harassment, police brutality all the time in our low-income minority communities. Segregation has, enabled an uneven resource. White communities, Beverly Hills, these communities get the best of everything. They have better financing, mortgage insurance, and these are some of the policies that excluded people of color from acquiring various types of assets. Beverly Hills, you have better infrastructure, transportation, security, streets, sidewalks. Communities of color, much higher rent for worse quality, and more expensive to ensure. Poor neighborhood amenities as well, not many parks. You're living in a second or third class community or even world. And even though most people were housed The rate and the quality is just is not the same. I know if you've been to South LA and you go down the street a couple miles down Beverly Hills, it's two different worlds, two different communities. And so through court enforced, desegregation, this began with the Supreme Court of the United States ruling that racial zoning was unconstitutional in 1917. And this began in the creation and prevalence of single family zoning in outside of multifamily housing. And with the Brown versus Board of Education, that starts to be enforced in the 1960s. So we begin to see the reduced density in planning documents. We begin to see barriers to multi-family housing. And so by uplifting single family zoning, we only have, we're creating a shortage intentionally where only certain people are able to access. And so in the city of LA in about the 1960s, they contemplated of about 10 million units, 10 million units being built. But as a result of efforts to reduce that density to prioritize single family zoning, the city had contemplated 4 million. So 6 million units, not being built. Definitely a huge disparity. And so without the guarantees of segregation, right? Without the guarantees of preserving our community character, without preserving how our neighborhood looks like, white Angelenos begin opposing multifamily housing. And in the 1970s, we see enforcement come into California. We have the infamous Proposition 13, people pulling tax money out of school districts and into their private homes. And then meanwhile, in the 80s, the Reagan administration begins shifting federal housing policies to higher income families. And we continue to cut funding for housing for those at the lowest income levels. And as of today, California ranks, I think, ranks the 49th in the country for ratio of households to housing units. Fewer housing units and subsidies for low-income folks, particularly communities of color, results in homelessness. We just don't have enough housing because the market simply won't build, right, for the lowest income folks. There's no profit for developers when it comes to affordable housing, and the government actually provides more subsidies for market housing, for mortgage deduction, and all these other benefits than it does for low income housing. So we see that homelessness is inevitable. The only question is, who will become homeless? It will most likely be, those who are excluded from accessing education, from accessing jobs, from accessing healthcare, who are bottled up in their communities that were historically based off of redlining. And we see higher rates for homelessness of people that are discriminated against, Black people, Native Americans, Latinos, people with disabilities whom suffer due to the root causes of homelessness. So I know this was about a 50 to 80,000 view of some of the root causes, and I was able to share a little bit of how people fall into homelessness, of why people fall into homelessness, and how the system was intentionally designed, for this problem to blow up into a crisis and what we're experiencing now. So looking forward to the Q&A session to answer some more specific questions. Thank you all.
Hey, thanks so much, Deon. I think we hear so many misconceptions about who are the homeless and why they end up on the streets in the media, and so it's really helpful for you. And I know you have a lot more, but just barely we're able to touch on some of the real factors that lead people to end up on the streets, and also who they are and why, right? Like what you talked about, the kinds of systems that then result in particular, that pretty shocking statistic of the proportion of Black people on the streets compared to their percentage of the population, right? So anyway, thank you again, Deon. So next, let me turn it to our own Grant Sunoo, who is the Director of Community Building and Engagement at Little Tokyo Service Center. So he manages our community planning and organizing work and our work to assist small businesses in the community, as well as overseeing a lot of our coalition work. He's part of the team that's putting together LTSC's new homeless services program. So let me turn it over to Grant. And also let me just remind you again, if you have questions for any of the panelists or for all of them, please go ahead and put them into the Q&A at the bottom of, click on it at the bottom of your screen. Grant?
Thanks, Eric, and thanks, Bibi and Deon, for your presentations. It's an honor to be on a panel with y'all, and even more of an honor to kind of collaborate and be in coalition with y'all and to partner. So for my part of the presentation, I'm going to talk about the impact that homelessness has on the Little Tokyo community at large, and then I'd also like to share a little bit about LTSC's approach. But first and foremost, I really want to underscore that homelessness has a tremendous primary impact on those who are unhoused. It seems obvious, but research shows that being homeless, leads to a lifespan that is 25 to 30 years shorter than the general population. So when you couple that with challenges of finding employment without a stable home, undependable public safety net, lack of interpersonal connections, it's clear that the best solution for homelessness is literally giving someone a home. On the other hand, the crisis has had a really major impact on other members of the community as well. So in Little Tokyo, we've seen day-to-day impacts that range from reported decreases in customer traffic, with many people citing homelessness as an issue in Little Tokyo as a reason not to visit. Public health concerns, things like misdemeanor crimes such as harassment or theft, and unfortunately violent crime as well, which has included multiple assaults on store owners, some on LTSC staff, and also some residents in affordable housing. And to be clear, I'm not arguing that any of these issues should be blamed on unhoused individuals. I think it's, I would argue that these are all byproducts of systemic inequities, that when human beings are placed into unjust and untenable situations, bad things happen. But neither is it the fault of small business owners who are trying to make a living or residents who want to feel safe in public spaces. And, I think rather I want to make the point that any response to homelessness in Little Tokyo needs to take into account both sides of this equation. And, so regardless of the cause, the effect is that people's reactions to these issues can devolve very quickly, and I would say are devolving and have devolved into polarization within the community. And ultimately, there's this divide that grows between the housed members of a community, business owners, nonprofit institutions, and other housed residents on one hand, and those who are experiencing homelessness on the other. And a lot of times, because these issues and challenges are, prolonged and protracted, people's views towards unhoused folks are hardened. I think people start to think that, well, maybe people are on the streets because of their own problems, like drug addiction, mental health problems, criminal activity. And I think folks' compassion for people who are experiencing homelessness as people is really reduced. And then on the other hand, advocates react to these comments as well. They dismiss the people who espouse them as bigoted or anti-poor and kind of characterize them as part of the problem, which really makes it difficult to focus on the goal that I think that we would all agree on, which is approaching homelessness with some degree of compassion and empathy as a community. And so when we think about LTSC's response, and as we've been crafting this response, our goal is to have a response that's really rooted in the values and the community that we believe in. And I would say that at LTSC, we believe in a Little Tokyo that is inclusive and welcoming, a Little Tokyo that's the home to 5 generations of Japanese Americans and a safe haven for generations of working class immigrants and migrants of all ethnicities. It's a neighborhood that supports the most vulnerable among us while also sustaining the legacies and traditions of our past. And it's a community that really brings out the best in all of us. We believe that a community-based approach to homelessness which is based in compassion, but reflects the needs of small business owners, religious institutions, community organizations, and all the residents of the community. That's the type of approach that we believe in. And specifically, we are building, and we're going to go into more detail on these specific approaches in the next couple of webinars, but just to kind of tease it out a little bit or to add a little bit of framework here. Specifically, we're working to build as much permanent supportive housing as possible, with 150 units of permanent supportive housing scheduled to come online in Little Tokyo. I hope our real estate development team doesn't get mad at me for saying this, but within the next few years. And we're also working immediately to build our capacity to provide direct services so that we can provide direct services to people who are experiencing homelessness in Little Tokyo, so that unhoused folks can be reached and assisted as they navigate into housing opportunities, but also to ensure that public spaces can be enjoyed by people and families without sweeping away unhoused folks and dumping them somewhere else. We're also putting an emphasis on advocacy work through coalition and policy work, really working on solutions to the root causes of homelessness, fighting for equity and justice towards public safety as it relates to all members of the Little Tokyo community, including those who are unhoused, and building coalitions with other communities of color, especially our neighbors in Skid Row, and standing in solidarity specifically with Black and Indigenous people of color in Little Tokyo and throughout Southern California. And I would say that, I think the last point that's important to make here is that we're not alone in this compassionate, values-driven approach. I think groups from churches and temples, as well as the Business Improvement District, many small business owners, have been on the front lines of this for years. Volunteers from J-Town Action and Solidarity have been providing mutual aid at Torimi Plaza for more than a year. And as I said, Little Tokyo is a neighborhood that brings out the best in all of us. I think that in closing, we really need to find common ground for all of us to work our way out of this crisis. At LTSC, as Erich said earlier, I think that we don't have all the answers, but we're committed to working with community to find them and to collectively understand the problem better and to develop short and long-term solutions that work for all of us, which is why I'm happy that there's so many people on this webinar and really excited to dig into some of your questions. So with that, I think we can go to Q&A.
All right, thanks, Grant. So we have a couple of questions in the Q&A. Let me start with one question, which is directed to Bibi, which is, how do you see the current use of Project Room Key for people who are unhoused and how effective it is?
Hi, thanks. Yeah, I'd love to answer that. So Project Room Key was initially started during the pandemic in 2020. I do have a personal story to share about that, but many of the folks that have intake into these Project Room Key sites, once the contract is up, many, at least for with PATH programs, we have a team that's dedicated to trying to transition them into other housing, ideally permanent supportive housing. Every person's individual situation is different. A lot of those sites as well have been converted into Project Home Key, which basically is then those hotel sites then get converted into actually permanent supportive housing sites. So one example would be for PATH, like our Orchid site in Hollywood that used to be a hotel. It served as a Project Room Key site. And then our Path Ventures branch acquired a contract to develop that and renovate that into an actual permanent supportive housing site for folks. So that's just one example, but also personally during the pandemic, I'm involved with the Skid Row Arts Organization here in Skid Row, which is Urban Voices Project. And we had one individual who was experiencing homelessness and was actually living on the streets at the time of the height of the pandemic, right when it all started. And so they reached out to me to see if I could help them out. And so I did reach out to our outreach team. It took a long process of coordination, but we eventually got that individual into Project Room Key housing. And that person stayed there for, I believe, close to a year. And then he was paired with a case manager and then referred to another agency, and then lived temporarily in apartment in Boyle Heights, and then from there then was able to acquire his own housing. So they did refer him into SRO housing, but he's now off the streets and is living in stable housing and is able to he's rebuilding right now. So that's just one example of how that's served. So I know that many of these PRK sites, when their contract is up, they have a dedicated team that does work with each individual to try to get them transitioned into permanent supportive housing.
Thanks, Bibi. Did any of the other panelists want to comment? Okay. The next question I have is, when I was growing up, Santa Monica was known as the home of the homeless. How did Skid Row develop such a high concentration of homeless people? And this is for any panelists to jump in.
Yeah, I can just talk a little bit about the history of Skid Row. So it all comes down to containment policy, right? And I'll explain a little bit of what that is and what that means. But early around in the 70s, Skid Row, most residents lived in single room occupancy hotels or SROs. And so, around the 70s, there was a few homeless people, but not as much as we see now, and not as rampant. And so with downtown growing and with downtown gentrifying, we there was a lot of developers that wanted to come into Skid Row and to take advantage of just the space that Skid Row has and to build, condos, apartments, right? That would take advantage of downtown's growing rate. And so, you had a lot of local neighborhoods around scared of the fact that, well, if there are developers coming in, and if downtown does gentrify, and if Skid Row gentrifies, and people would leave, and homeless people would now come into our neighborhoods. And so, a policy of containment was enacted that, instead of pushing for services that would help individuals to treat individuals, right, to provide housing first models. Instead, we'll contain folks, keep them within the boundaries of Skid Row, and be met with harsh criminalization policies if they decide to emigrate out of the Skid Row zones. And so that is essentially how Skid Row began to grow. It became a dumping ground, if you will, for individuals experiencing homelessness. If for example, if you went to a hospital and you had no address, right, you would be sent and shipped to Skid Row. Other communities would usher you into Skid Row if you lived around, around downtown LA, right, because that's what Skid Row was. And so it essentially just became that with policies of containment. Skid Row became a place where homeless people went to. The LA City had also, put shelters and some small services there, right, to be there for folks. Put a park, Gladys Park, with the thought that people would congregate at that park, and so it would be satisfying, and people wouldn't see the need to emigrate outside. And so that's a little bit of the reason why Skid Row has grown, and why there is so much poverty and homelessness in Skid Row. It's just simply the containment policies with the inaction of providing affordable housing units, with the just demolishing of Section 8 across the board. And so that's a little bit of how Skid Row is, why Skid Row is.
Thanks a lot, Deon. Okay, another question here is, despite increased efforts, why does the homelessness problem feel like it's growing worse? So again, this is open for anybody to. If I could just jump in real quick, I think one of the keys is the statistic that Deon had in his presentation, which is the idea that while the system is not perfect, it is moving people into housing. And so on average, 207 people are being moved into housing every day. The problem is 227 people fall onto the streets every single day, right? And so that's why it doesn't just look like it's growing worse, it is getting worse. But it has to do with the economic reasons, the fact that LA is the most unaffordable housing market in the country, and things like that. So just want to throw that in. So other.
Sorry, I missed the question, if you wouldn't mind rephrasing.
It's just despite all the increased efforts and resources, why does the homelessness problem feel like it's getting worse?
Erich, I kind of think you nailed it.
I can add. I think there's like 3 different prongs when it comes to homelessness, right? You have the prevention side. You have people that are on the streets experiencing homelessness, and then and what services do you provide, right? For example, like public toilets, food, and how do you get, and the X flow, right? The outflow of how do you get people out of homelessness. And so when, as Eric mentioned, right, the inflow is why we're seeing such visible homelessness on the streets, right? And how many people do you know, right, that are having landlord issues, apartment issues, that are, with rents increasing, with rent controlled units, diminishing, right? And so if we can't have proper eviction protection programs in place, if we can't, with COVID and with so many people losing their jobs, if we can't provide extra funding and extra safety net and extra economic net, then we can't provide, then people are ultimately going to end up falling into homelessness, right? So I think it all really begins at the inflow level. Once you find a way to stem the inflow, then we can work on the visible homelessness. But anything else, people are just going to keep falling into the trap. So as we saw, 59% of folks, are falling into homelessness because of economic reasons, right? Such as in baby situation. And so how do we provide extra funding for people that are on the brink? How do we protect people's homes while they still have homes, right? You have to put in tenant anti-harassment ordinances so landlords can't get away. Ellis Act, so if landlords or if developers see the need to kick out somebody and renovate the unit and, make the unit about, almost twice as much, right? How do you prevent folks from doing that? So how do you protect people from keeping their homes? How do you protect people keeping their homes so that way the inflow doesn't grow?
That's great, Deanna. I just wanted to also add and piggyback off of what you were saying. In a real life scenario, we're coming out of this pandemic, and we've been in this pandemic for almost 3 years. And so that also added to this crisis and worsened the homelessness crisis issue. And I remember helping out at PATH during 2020, 2021 at the front doors and helping to triage many people that came to our front doors for services. And many of these folks were experiencing homelessness for the very first time. They had lost their jobs. They were just exhausting all of their personal income, sleeping in hotels. I was seeing an increase in influx of families living in their cars, even families with one child. There wasn't enough housing vouchers. At the time, the housing vouchers were regulated by DPSS. And then there was not enough shelter beds, we would give them the sheet of a list of shelters that are operating, but then also the shelters had to limit the numbers of the amount of people in the shelters due to COVID protocols. So that's why there is an uptick of people also on the street. And so, I think the COVID-19 hasn't helped this crisis at all. It's just added to the numbers, and we are coming out of COVID, but there isn't enough resources for homelessness prevention, and I think that's also key. And also working with landlords to offer more of their units for people that are living below the poverty line. There's not enough of that, and also just rent control. But I would say just wanted to highlight these last 2 years has been extremely difficult for folks economically, losing their jobs and making ends meet. And that's why you see physically so many people living on the street.
Okay, thanks everyone. We're coming down to a time crunch, so we actually have a lot of really great questions that I would love to be able to get to, but I don't think we'll be able to get to, most of these questions. But there is one, let me just throw out there. Are there long-term plans for helping the homeless or preventing people from becoming homeless? It seems like there are a lot of short-term plans that fizzle out and don't provide a roadmap for a long-term solution. So
Eric,
any
can I
panelist
chime in?
can take a shot.
I've got one long-term solution that I think is worth sharing is and requires some urgent action now, is the United to House LA campaign, which is a ballot initiative that's being proposed for the September ballot, or November ballot, excuse me. That is a real estate transfer tax on properties over $5 million. So I'm going to hazard a guess that most of us on this call are not going to be affected justify this tax. But it is going to raise $800 million a year for supportive housing, the construction of supportive housing, as well as homelessness prevention. And I actually had a meeting with some of the campaign folks this morning, and there's this really urgent push over the next week and a half to get all the signatures in. And there are a number of signature drives going on throughout the city. So if folks are interested in volunteering, we could really use some volunteers to just kind of help get the word out and collect signatures. And if somebody approaches you at the supermarket asking you to sign a ballot initiative about affordable housing, please, I would urge you and plead with you to sign it. And I will send a link to the more information. Or I see Deon put it in there already. Thank you.
Okay, I think that's all we're going to have time for. I really feel badly because, like I said, there are a lot of questions that came into the Q&A, and there are a lot of really good questions. So I would really encourage you, to contact LTSC with those questions, and let's engage in more discussion and conversation about a lot of the both points that people are making as well as questions that you have. Let me encourage you to check out our future webinars in the series. We don't have the date set yet, but please check on www.ltsc.org/homesick. Our second webinar is going to explore community responses to homelessness, kind of the landscape of approaches and solutions that different people and organizations are taking. And webinar number 3 is going to really focus on affordable and permanent supportive housing and why it works. After the webinar ends, let me just mention, you'll be prompted to complete a survey with your feedback for this webinar. So if you have a few minutes, please fill out and submit the survey to help us improve our future webinars. And again, thank you so much for joining us, and let's hope that this is just the beginning of learning and conversation about this crucial issue. Thank you so much.
Thank you all.
Thank you.